So I'd like to go over the 3 cool down stretches that you can do to help with your client's spinal and hip flexibility. Again, my name is Dr. Chad Kuntz. We're going to go over the 3 cool down stretches. They're not the only 3, but they're a really good set of 3 stretches that you can do to really help improve your client's spinal and hip flexibility. Notice that it's cool down. All right, so generally speaking, I like to do more of a dynamic stretch with my clients prior to. Get the blood flow going, get them moving. Let's kind of just briefly review 4 different types of stretching. So ballistic, that's what it's going to be. Quick, almost kind of plyometric stretching. I got an X next to that one because, guys, generally that one's not safe. There's almost always exceptions, but for now, for where you guys are at, I'm going to say try to hold off on ballistic type of stretching. Dynamic, I really like dynamic stretching for prior to working out. So again, just a quick example might be like a lunge where you're reaching overhead or you're rotating. There's varying, different types of flows that you can do, hip rolls or what have you, to get people warming up. I think that's a really good way to get started, to get people to warm up. Hip swings, that's another one. Passive, I think passive is fine too. Sometimes the body just needs a lot of force to move even a small distance. For my really tight guys more than women, they need some pretty intense passive stretching because their body's so tight they'll never get there if it's just actively, okay? I didn't put active up there, but there is kind of active types of stretching, which can be great as well. I'd say active type of stretching is really good for just motor control and coordination and learning how to move, which is fantastic. Today we'll be predominantly covering active assist type of stretches. We'll be using a stretch rope, which I find really helpful. And I find that using active assist, you can teach the body to kind of go a little bit further, and then you can actually teach your muscles how to really own that movement at the end range of motion. It's kind of like this analogy with a kid. Let's call this a spoon. If I feed a kid a spoon, or if I feed him food with the spoon all the time and I never teach that kid how to feed himself, do you think he'll teach himself how to feed? Probably not really, or it'd be like really delayed and slow. But if he can only go this far, but if I can help him go a little bit, and then I say, hold it right there, take the bite, and now you know how to do it, chances are he's going to figure out, or she's going to figure out, hey, I can do this on my own. That's kind of the general principle that I find active assist exercises being incredibly helpful for my clients. And we do use a stretch rope, or a yoga rope, some might call them. So with that being said, let's get into 3 stretches that you guys can do starting tomorrow for your clients after they finish. And they're going to hit some really key muscle groups that I find are just really tight, okay? The first one's going to be a hamstring stretch. So what I like to do is make sure, guys, by the way, their toes are pointing towards their nose, okay? They're pointing up the whole way. You've got the stretch loop wrapped around the mid part of their foot. It's kind of nice when you have the toes towards the nose because it puts a little bit of stretch on let me see if you can guess it, the nerve. All right, so what we have to kind of have in our mindset is that we're stretching not just the muscles, but we are often stretching the nerves. The big guy called the sciatic nerve, and the nerves that refer from the lower lumbar back, those need to be stretched too. And it doesn't just need to be done in a sagittal motion up and down. And what you might have just seen there is that green arrow indicating that I'm going to encourage you guys to try to rotate it in and out. And I'll show you a top-down view here in a second, okay? But when you rotate it in and out, you're kind of flossing the nerve in a different way. This, as a reminder, are the hamstrings. We have the nerves that pierce back there. And what I'm eliciting there is that you've got your 2 inner hamstring muscles, the semitendinosus and membranosus, and those are responsible for internal rotation of the hip and tibial internal rotation of the knee. Whereas the bicep femoris, which I've got highlighted there, is responsible for, of course, hip extension, but hip external rotation. It's a secondary actor. And then you've got tibial external rotation as well down below. So we need to be able to really stretch out all of those different muscles. And I don't even have the nerves up there. The nerves are even crazier in terms of complexity. So watch how I'm going to rotate here in a second. Bring it up, pulling, tugging, and then I'm going to go ahead and rotate it. It's coming up. I think it's this one. There we go. All right, so I'm going to go ahead and rotate it all the way in, all the way out. You can use your hands to kind of guide that, there's some hip internal external rotation going on. It's interesting, people feel different types of stretching and pulling and sensations when you're stretching that muscle. We tend to think muscles only work up and down or sagittally, but muscles have to kind of be twisted and pulled and stretched in all different planes in the transverse plane in this manner. So it's a really nice touch to doing a traditional hamstring stretch. And your clients are going to be like, wow, I feel all kinds of different stuff when I go in and out like that. You're trying to keep the heel up towards the ceiling. I am trying to straighten my leg, and that's where I'm kind of actively using my core and my quads. If they feel more of a stretch going in like that, that typically is from the low back, okay? Typically the back is referring sensation, the nerves are tight. That's a neural sensitization technique that we might use as therapists. So if they feel more going in, just have a little bit of a cautious yellow light. Whereas if they feel more going out, that tends to be more of a peripheral nerve-based tightness where we're not too worried about that. It's coming less from the back and more so from the periphery. So that's the hamstring stretch. Hamstrings have a huge role in proper squats, lunges, deadlifts, and all those foundations. So for that reason, they made our number one thing to do immediately after. The second one that you can do with your stretch rope is called a pretzel stretch. It's a little bit more complex, but once you get the hang of it, man, this really stretches all kinds of stuff. More of an emphasis here on our spinal flexibility, but not to mention hip as well. So how do you do it? You bring the top leg up and across your body. Now, as shown, it's a knee bent position. You could straighten that leg and put a little bit of a hamstring stretch on it too to modify it, which is wonderful, but it's also a little bit harder for your typical clients. I'm guessing they won't be able to do it. It's kind of a luxury if I'm able to work my way up into that. I brought my bottom heel towards my butt. I mean, you can see I'm pulling that with my left arm. So I've got some tension with that stretch rope around my left shoulder, kind of hooking it around my trap. I've maximized my right heel towards my butt cheek, and I'm pulling my right hip back into extension as my right arm is pulling my top leg up and across. Now, if you notice right there, I'm doing some really deliberate, deep breathing. Most times when I cue people to do the deep breathing, they do not do a good job of it. It's very short, it's accessory, it's upper chest, and is really all they're giving me. What I found, it's incredibly helpful to get really big, deep breaths, pushing through your intercostals, giving yourself a big inhalation. And when you exhale, as I noticed there, I'm able to crawl my back left shoulder down towards the ground, okay? So what's wonderful here is that we're really getting through the entire spine, rib cage, left glutes, somewhat left even hamstrings and left QL, and then right hip flexor, both psoas and rectus femoris. So just one more time, this is the equal and opposite side, just to show you how we got in that position. The stretch rope is looped around the midfoot, pulling my top leg up and across, anchoring in the top leg, pulling that up, deep breaths in, exhaling. I like 3 rounds of about 3 big deep breaths as I exhale. You'll be surprised how much more you can go. And remember, guys, we're always assessing. We're always assessing, so when you're doing this with your client, be curious, ask them, how's this feeling? Does it appear tighter compared to the other side? 9 out of 10 times, people are feeling a big difference. We have big asymmetries and imbalances, and if you can help correct those imbalances just from your training, that's very powerful. This is one of my favorites. You do need help to kind of keep tension everywhere, and for that reason, we're using the stretch rope. And for that reason, it makes kind of my number 2 thing that you should do afterwards. A set of even 10 reps on each side would be fantastic. Or you could just think about doing like 3 sequences of deep breaths in a row. And even if you did that once on each side, I think that'd be a great place to go. So this is one that I've kind of named the inner thigh sweep stretch. Now I want you to really pay attention how my right ankle there is secured, okay, by the pull. And then I'm pulling my leg all the way up, and then I'll be coming down. And I am keeping my toes pointed towards the nose on that one, okay? Now, this is just a different angle. All right, so we're pulling it all the way up, pulling all the way down. You're trying to keep tension with this adductor or inner thigh stretch as you pull it all the way up. And as you come down, trying to slowly lower it down while keeping tension, while keeping toes to the nose. The adductors have a profound effect on the pelvis, the low back, the hips. They're kind of analogous to the lats in the shoulder, because if the lats get tight, the whole thing just really kind of shuts down and you don't get the full range of free motion. So I like to kind of hang out in that position for a second. Notice how the pull is anchoring my left leg. You really need to stabilize the equal and opposite leg if you're trying to get into the adductors the way you truly want to. I want to say if I had, yeah, exactly, okay. So, yep, pulling all the way up. You get a little bit of hamstring there. As you come down, as a reminder, there are various different muscles within the adductors. You've got your gracilis, you've got the adductor longus and brevis and magnus, and they all kind of get pulled and stretched at different angles. So I don't like to just settle at one. I like to kind of work my way all the way up, all the way around. And I particularly felt the best stretch there, so I'm most likely hitting the gracilis. And remember that muscle is particularly stretched when the leg is straight. So those are the inner thigh sweeps. It's really kind of a cool variation to go into the adductors to kind of really stretch that out. Okay, so we went over 3 different stretches today, guys. And I think they're all really helpful. They're not the only 3 that you could do with your clients after you work them out. But the hamstrings really need a lot of attention and work for a lot of clients. And they have a big effect in squats and deadlifts and lunges, as I said earlier. The pretzel stretch is really great for spinal flexibility and hits about every part of your muscles and your hips as possible, so that's wonderful. And I wanted to kind of bring some tension to the adductors. I feel like they're less stretched more than other muscles, like for example the hip flexors and the piriformis get a lot of attention. The adductors do not. And the adductors have a massive, massive play. No one ever seems to be palpating that tissue. No one ever seems to be loosening that up. They kind of get just left in the dark. So I wanted to bring up to attention the inner thigh sweep stretch, which really helps open up the hips, the pelvis, the low back, and anyways, just kind of bringing it up to the side and pulling it up. You might have seen that one before, but I think a key distinguishing factor is making sure that the opposite side is stabilized as best as you could. You can stabilize it on the inside of the shin on the opposite leg, or you can even go up above the knee and stabilize it that way. As long as you're getting some stability in the opposite side of the leg, I think you're going to really find you can get a much better, more efficacious stretch. So I hope that was helpful. Thanks for hopping on. Have a great rest of your day.